Once you do that, once you bring forward that you feel empowered enough to bring your best self forward and bless whatever it is that you're choosing to take inside your body, then now the level of awareness is, well, is this the best for me? Is this the best medication? Is this the best route that I can take? And there are other choices. Dara talked about the distinction between a medication such as, let's say, Synthroid, which is levothyroxine, and it has, the content that it has is a little bit different. Not only it's synthetic, but it's also, it's not a combination of various different hormones. So understanding, getting a picture, going on Google, I love technology, going on Google and just doing thyroid. Just Google thyroid and press image. And then, or whatever search engine, I'm not attached to Google, but whatever search engine, or go get a textbook of anatomy in your public library. Where's my thyroid? Where's my pancreas? Where's my liver? Where is it? And then every day, spending 1 minute, 2 minutes, 30 seconds, 5 minutes, half an hour, whatever length of time that you feel comfortable, and just sitting there and just blessing your thyroid. What does that mean? Just, putting your hands right over it. God, I love you so much. You're so important to me. Thank you so much for functioning so well for me. I want to take care of you. I want to nurture you. I want to give the best food to you. And then that will bring forward your best self to start looking. Well, my thyroid, what does it need? Does it need iodine? Does it need cruciferous vegetables? The cruciferous vegetables such as broccoli, kale, seaweed, things like this. Well, should I steam it? Should I not steam it? Should I have it raw? These are the nitty-gritty. The details will come to you. Because once you start being loving, to yourself, you see, that will allow you to be curious, will allow you to be intuitive, would allow you to kind of think out of the box. Then you start making the right choice. Then having burger every day and with your Diet Coke or this or that, it's not the right thing. And you intuitively know that because you want to really take care of yourself. Nutrition is important. Self-talk is important. And then you can start looking at an integrative practitioner who can create a support system to some extent for you. And Dara requested, and she's so precious and important to me, and I'll be willing to do that. What you could do is you could send an email to info@beehiveofhealing.com, info at beehiveofhealing.com. Beehive of Healing is spelled with one E, so it's BEHIVEOF healing.com. You send it and you just request. I live in Hawaii, and do you have a particular physician who practices similar to what you do?
Which is, what do you call what you do? We never introduce what your...
Sure. It's referred to more of an integrative medicine. It's more like these are practitioners who are either internists or family practitioner or specialists who think out of the box, who've studied nutrition and who've studied various different modalities, and they bring it together. My background, I've studied osteopathy, Ayurvedic medicine. When I was in India, I studied a little bit of Ayurvedic medicine and Tibetan medicine and anthroposophy. And I'm a family practitioner, and I've brought it all together, and I've created something that's referred to as IBM, or Integrative Bioregulatory Medicine. And and I'm the founder. But I'm in the process of writing a book. Depending on the rigors of the editorial process, my book will be coming out within the next 3 to 6 months, and it's toward patients. It's not for practitioners. So that hopefully will add a little bit in terms of your awareness, so that you could feel empowered. Taking your power back. And you're not a number. You're not a particular disease model. And we can change that. And I see it every single day. And the most important part is to bring and to invoke your most centered, loving self into the game. And then to play from that perspective.
So we'll put a link. I'll put a link underneath this video, so where you can contact Dr. SADEGHI in his office, and that's amazing of you to do that. Thank you.
My pleasure.
Really.
My pleasure. You've been so generous of yourself, with your journey, and wanting to help so many, so many men, so many women. Okay, that they don't know. They really don't know. And this is going to touch many lives.
Yeah,
and
this is a really good start. Thank you so much.
My pleasure.
All right, everybody. I think that's it for now, and we'll see you soon.
Yeah. Thank you. Yeah.
Okay.